1885, Guy de la Tourette described 9 patients who suffered from a disorder characterized by involuntary movements and strange uncontrollable sounds. In his article, Tourette presented some early descriptions of this disorder. Tourette noticed several movement disorders that he thought were similar to each other, yet different from true chorea. A chorea is an abnormal, involuntary movement. The disorder later took Guy de la Tourette's last name. Tourette affects approximately 0.5% of the population, and it's more prevalent in males than females, and is proportional across the normal curve of intelligence to that of the population as a whole. Basically, while the vast majority of individuals with Tourette's syndrome fall within the average range of intelligence, it's expected that approximately 3% of the individuals with Tourette's syndrome will be gifted, and 3% will be developmentally disabled. The diagnosis requires only one phonic tic or twitch. A phonic tic or twitch is defined as a sudden, rapid, recurrent, non-rhythmic, stereotyped sound, and 2 motor tics or twitches. Motor tics are defined as sudden, rapid, recurrent, non-rhythmic, stereotyped movements as opposed to sounds. Simple phonic tics include excessive, exaggerated, and/or continual sniffing or throat clearing. Simple motor tics include eye blinking, widening, winking, head jerking, shoulder shrugging, or facial grimacing. In more severe cases, tics can also involve more complex movements or sounds that might be misinterpreted as purposeful. This includes shouting profanity, insulting content, or phrases.
I'm trying my best to hold it in. Shagging! Fuck off! Sorry. Sorry.
Coprolalia, the infamous and overly represented swearing tic, is an exceedingly rare example of a complex phonic tic. Only about 7% of individuals with Tourette's syndrome exhibit this tic. These individuals tend to be older and with more severe and complex cases. Tourette's syndrome affects people of all racial and ethnic groups. However, a Tourette's syndrome diagnosis is twice as likely amongst white people than among Hispanic and Black people.
Tourette's syndrome is a very complicated disorder to trace and keep track of. This is because the disorder is thought to be inherited but will only appear about 50% of the time, with males being approximately 4 times more likely than females to have the disorder. Even though offspring may carry the gene, the disorder may not appear at all. Scientists do not yet know the exact gene affected, but believe it is rather a combination of multiple defective genes along with environmental factors that contribute to the onset of Tourette's. The gene's location is not known, as the studies conducted have not yet proven the exact location of the gene affected. However, the fact that it is more common in males than females suggests that it is X-inherited. Recent research suggests that a small number of Tourette's syndrome cases may be caused by a defect on chromosome 13 of the gene SLITRK1.
The diagnosis for Tourette's syndrome is only made after verifying that the patient has had both motor and vocal tics for at least 1 year. There are no blood or laboratory tests needed for the diagnosis, but neuroimaging studies, such as magnetic resonance imaging, computerized tomography, and electroencephalogram scans can be used. Certain blood tests may also be used to rule out other conditions that might be confused with Tourette's syndrome. Although the disorder is generally lifelong and chronic, it is not a degenerative condition. Individuals with Tourette's syndrome have a normal life expectancy, and the syndrome does not impair intelligence. Although tic symptoms tend to decrease with age, it is possible that neurobehavioral disorders such as ADHD, OCD, depression, generalized anxiety, panic attacks, and mood swings can persist and cause impairment in adult life. Although most people can live their everyday lives without being affected by Tourette's, there are treatment options that may help severe cases. Gene therapy is currently not a possible treatment option for people with Tourette's, as the location and identity of the gene must be first confirmed in order to have a clinical trial. Doctors usually try to avoid chemical treatments because drugs can often make cases worse than what they usually are. Instead, they usually advise counseling for less severe cases of Tourette's. Treatment plans for those with more severe cases of Tourette's are unique and custom-made by the patient's doctor. They usually involve time spent recording the patient's condition and creating the most suitable plan. Treatment plans are unique to the patients, and because of the effects of different drugs and dosages, it can affect different patients in positive and negative ways. Alternative medicines like deep brain stimulation and comprehensive behavioral intervention for tics are an effective way to deal with the effects of Tourette's, as detailed by the Tourette's Association of America. Since Tourette's syndrome has a 100% inheritance rate, it can remain a dormant gene in one's brain. This gene can be made active through environmental stimulation, such as drugs. Although drugs can awaken this Tourette's gene in those who have it, in some severe cases, cannabis is being trialed as an effective treatment for Tourette's. Take a look at this man with an extremely severe case of Tourette's before and after smoking cannabis.
Frühmorgens. Billy Wischolek möchte einen Kaffee, doch es ist fast unmöglich. Seine Muskeln zucken so heftig, dass es ihm kaum gelingt.
Ich krieg eigentlich so gut wie gar nichts gebacken. Also wenn die Kaffeemaschine nicht gerade mal 2 Knöpfe hätte, dann könnte...
Billy raucht Cannabis, eine illegale Droge. Der darin enthaltene Wirkstoff THC hilft ihm, ein normaler Mensch zu werden.
20 Minuten ungefähr. Das dauert. Ich habe mehrere Medikamente getestet, auch testen müssen, viele schlimme Medikamente, wo ich meinen Körper noch schlimmer
Okay, so to finish off the video, we're just going to show a couple clips from an Australian documentary about Tourette's to give you some more information.
But being the centre of attention in daily life is another. The next day, we visited Liverpool's museum and aquarium.
Wow, look at the fishies, look.
I find it physically tiring because you're trying to like hold it in because you don't want to release the tick, but you've got to release it eventually, and you just feel physically drained, like you've just run a marathon. You're tensing everything up, and then when you've released it, it's that relief, and you just feel physically drained.
Does that hurt? Do you ever hurt yourself?
No.
Tourette's is little understood. It's not even known what triggers it. But neuropsychiatrists like Hugh Rickards believe the secret may lie in the centre of the brain.
We're pretty sure that a bit of the brain called the basal ganglia is the bit that's different. And one of the things that the basal ganglia does is that it filters drives and ideas and thoughts. And really what's happening in Tourette is that you've got a breakdown of that filtering process. So you're getting, if you like, non-salient thoughts or very mildly salient thoughts coming right to the front of your attention saying, do me now, say me now. And that's what's really happening, I think, in the brain of people with Tourette's.
So majority of cases aren't as severe as the ones displayed in the video. However, it's important to remember that they cannot control what they're doing. It's kind of like a sneeze, and it has to come out. So they really don't mean anything by what they're saying.